In this podcast episode, urologist Dr. Rena Malik discusses various aspects of sexual health and anatomy. She addresses common misconceptions and insecurities that men may have regarding their sexual performance, particularly related to penis size. Dr. Malik explains that the clitoris is the only organ in the human body specifically designed for pleasure. It is located above the urethra and wraps around the vagina like a wishbone. She highlights that 85% of women require clitoral stimulation to achieve orgasm, emphasizing that penetration alone may not be sufficient for many women. The average penis size is around 5.1 to 5.7 inches, and studies show that women tend to prefer sizes similar to the average when it comes to sex toys. Women's preferences for penis size can vary, with some finding larger sizes uncomfortable or even painful. Dr. Malik discusses the possibility of enlarging the penis through various methods, such as traction devices, vacuum erection devices, and surgical procedures. While traction devices have shown some benefits in increasing length, there are risks involved, and it is essential to use them safely. Surgical options like implants can also lead to complications and are not without risks. It is crucial to approach penis enlargement with caution and prioritize safety. Erectile dysfunction is primarily caused by issues related to blood flow, with vascular problems being the most common cause. Dr. Malik emphasizes the importance of maintaining heart health to support erectile function. Factors like diet, exercise, and managing underlying conditions such as high blood pressure and diabetes can help prevent erectile dysfunction. She also mentions that psychological factors, neurologic issues, hormonal imbalances, and certain medications can contribute to erectile dysfunction. The placement of the clitoris internally and its relationship to vaginal penetration raise questions about evolutionary anatomy. Dr. Malik explains that the clitoris and penis share similar tissue origins, but the clitoris has additional parts that extend along the vaginal canal. The variation in vaginal anatomy, pelvic floor muscle tone, and the distance between the clitoris and vaginal opening can impact sexual pleasure and comfort during penetration. Women's preferences for toy sizes may also be influenced by individual anatomy and comfort levels. Vaginal reconstruction procedures are often performed to address issues like pelvic floor weakness, prolapse, or cosmetic concerns. These surgeries aim to strengthen the pelvic floor muscles and may involve tightening the vaginal opening. However, tightening the vaginal opening does not necessarily make a woman tighter in a sexual sense. It is essential to differentiate between aesthetic changes and functional improvements in pelvic floor health. Dr. Malik touches on the potential mismatch between penis size and vaginal anatomy, which can lead to challenges in sexual compatibility. A large penis paired with a small vagina, or vice versa, may cause discomfort or difficulties during intercourse. Understanding individual anatomy and communication between partners are crucial in addressing any concerns related to size discrepancies. Dr. Malik stresses the significance of trust in achieving orgasm for women. She mentions that women need to feel comfortable and vulnerable with their partners to fully enjoy sexual experiences. Open communication about desires, preferences, and feedback is essential for a satisfying sexual encounter. Dr. Malik encourages individuals to talk to their partners outside the bedroom to discuss what they enjoy and what turns them on. Dr. Malik suggests that many women are not familiar with their own anatomy and urges them to take the time to explore their bodies. She recommends using a mirror to understand the different parts of the genitals and identify what feels good. By experimenting with touch, temperature, and vibration, individuals can discover what brings them pleasure and enhance their sexual experiences. Dr. Malik explains that lubrication is crucial for comfortable and pleasurable sex, especially for women, as the clitoris does not produce its own lubrication. She also advocates for the use of sex toys to enhance sexual pleasure and satisfaction. By incorporating different sensations and exploring new experiences, individuals can spice up their sex life and discover new sources of pleasure. Dr. Malik discusses the average duration of sex, which is around 5 to 6 minutes of penetrative intercourse. She emphasizes that the quality of sex is more important than the duration, and that individuals should focus on enjoying the experience rather than worrying about how long it lasts. She mentions that women typically desire longer sexual encounters, averaging around 25 minutes, including foreplay and other activities. Dr. Malik addresses issues of premature ejaculation and delayed ejaculation in men. She explains that premature ejaculation is defined as ejaculating within a minute or two, while delayed ejaculation occurs when it takes 30 minutes or longer to ejaculate. She emphasizes the importance of individual satisfaction and partner communication in addressing these concerns and finding solutions that work for both parties. In first-time sexual encounters, Dr. Malik suggests discussing preferences and desires with the partner before engaging in sexual activity. While spontaneity and chemistry play a role in initial interactions, open communication during the act can enhance pleasure and ensure both partners are satisfied. She encourages individuals to ask for feedback and be attentive to their partner's needs to create a fulfilling sexual experience. Dr. Malik recommends starting with foreplay, teasing, and exploring erogenous zones before moving on to penetrative sex. By prioritizing their partner's pleasure, being attentive to cues, and engaging in open communication, men can create a positive and enjoyable experience for both individuals. Dr. Malik stresses the significance of open communication in relationships, especially when it comes to sexual intimacy. She highlights the importance of discussing preferences, boundaries, and desires with a partner to ensure a fulfilling and satisfying experience for both individuals. By having honest and open conversations, couples can better understand each other's needs and enhance their connection. Dr. Malik emphasizes the importance of clitoral stimulation in achieving orgasm for most women. She suggests that partners should focus on providing adequate clitoral stimulation during sexual encounters to increase the likelihood of orgasm. By paying attention to cues, adjusting the intensity of stimulation, and exploring what works best for each individual, partners can enhance their sexual experiences and promote mutual satisfaction. Dr. Malik emphasizes the importance of mutual respect and equality in relationships. She highlights the need for both partners to feel valued, desired, and respected in order to establish a healthy and fulfilling connection. By treating each other as equals, communicating openly, and prioritizing each other's pleasure, couples can build a strong foundation for a lasting and meaningful relationship. Dr. Malik discusses the challenges posed by modern society, including the accessibility of pornography, sedating behaviors, and distorted views of relationships. She acknowledges the impact of technology, social media, and unhealthy habits on sexual health and relationships. By addressing these challenges through education, communication, and setting boundaries, individuals can navigate the complexities of modern society and maintain healthy and fulfilling relationships. Dr. Malik emphasizes the importance of parental involvement in sexual education and communication with children. She encourages parents to have open and honest conversations with their kids about sex, pornography, and healthy relationships. By providing guidance, support, and accurate information, parents can help their children develop a healthy attitude towards sexuality and make informed choices in their relationships. Dr. Malik explains that testosterone plays a crucial role in sexual health, including libido and erectile function. She highlights the importance of maintaining healthy testosterone levels through lifestyle factors like diet and exercise. She also mentions that resistance training can help boost testosterone levels, while excessive endurance training may have the opposite effect. She also warns against the negative impact of endocrine-disrupting chemicals on testosterone levels. To naturally boost testosterone levels, lifestyle factors such as getting adequate sleep, following a healthy diet like the Mediterranean diet, and maintaining a regular exercise routine can be beneficial. Additionally, exposure to natural light in the morning and evening can help regulate circadian rhythms and improve sleep quality. Dr. Malik explains that erectile dysfunction can be caused by various factors, including low testosterone levels, blood flow issues, and psychological factors. Testosterone plays a crucial role in sexual function, and low levels can lead to decreased libido and erectile problems. She emphasizes the importance of addressing underlying health issues, such as obesity, high blood pressure, and diabetes, which can contribute to erectile dysfunction. Dr. Malik discusses various treatment options for erectile dysfunction, including medications like tadalafil, Cialis, and sildenafil, Viagra. These medications work by increasing blood flow to the penis, facilitating erections. She also discusses shockwave therapy as a treatment for erectile dysfunction. She explains that shockwave therapy works by stimulating the growth of new blood vessels in the erectile tissue, improving blood flow and erectile function. While the data on shockwave therapy is promising, Dr. Malik notes that more research is needed to establish its effectiveness fully. She also mentions the importance of maintenance protocols for long-term benefits. Dr. Malik explains that while marijuana in small doses can increase libido, frequent use can affect sperm quality and sexual desire. Similarly, alcohol consumption can lead to erectile dysfunction and decreased libido, especially in excessive amounts. She advises moderation in both marijuana and alcohol consumption to maintain sexual health. Dr. Malik reassures men that they are not alone in experiencing sexual health issues and emphasizes the importance of seeking professional help. She acknowledges the stigma and reluctance that men may feel in discussing sexual problems, but stresses the importance of addressing these issues for overall well-being. She encourages men to prioritize their sexual health, seek medical evaluation, and explore treatment options to improve their quality of life. In addition to discussing male sexual health, Dr. Malik touches on the importance of vaginal estrogen for women's sexual well-being. Vaginal estrogen can help maintain vaginal health, prevent UTIs, and improve sexual comfort. She recommends considering vaginal estrogen for postmenopausal women experiencing vaginal dryness or discomfort. Dr. Malik briefly touches on PRP injections and stem cell therapy as potential treatments for erectile dysfunction. She explains that PRP injections involve using platelet-rich plasma from the patient's blood to stimulate tissue regeneration. However, she notes that the data on PRP injections for erectile dysfunction is still inconclusive. Similarly, stem cell therapy is being investigated for its regenerative potential, but more research is needed to determine its effectiveness. Dr. Malik discusses the use of finasteride for hair loss and enlarged prostate, highlighting its role as a DHT blocker. She mentions the potential side effects of finasteride, including sexual dysfunction and the rare occurrence of post-finasteride syndrome. Post-finasteride syndrome can lead to persistent sexual side effects, impacting a person's quality of life and mental health. Dr. Malik emphasizes the importance of caution when prescribing finasteride and monitoring for any adverse effects.